Today what we are going to be discussing is very important but very ignored kind of subject and most important topics from this subject. Fmge June 2020 is in 17-18 days from now when I'm recording this video. So I know you must all be very busy and very um, in stress. Although I hope you're not stressed because stress only worsens things up. But anyways, so Fmge June 2021 ignored before but so important now. That is what we are going to discuss now. So the subject for Fmge June 2021 that has gained so much of importance is because of the ongoing pandemic, right? So anesthesia has gained actually a lot of value. There is a high chance of getting more questions asked from anesthesia than before. Like before, they would ask you one or two, maximum three questions roundabout, but this time there might be more questions from it. So I would suggest do not ignore it because this is a short subject, but the yield would be more and it will be easier to cover it up. And plus, if you have read it once, some of it once, the confidence level is going to be up that you have done it. So I would suggest that even if there is only 17 to 18 days left for your exam, do read the selective topics of anesthesia. Don't leave it and go, because right now with ongoing conditions and stuff, it has become really important. You can't miss it and go. We all have been guilty of ignoring the subject. We have done it. We know it. We don't give much importance to anesthesia ever. So then why should we study now? As I have already said, COVID-19 critical patient care management is very important, very hot shot. Vital things that are a must to know in any hospital setting is the need of hour. You have to know some of the basic anesthesia things which were before might not have been asked in your Fmge, maybe in PG but not Fmge. But this year, with the ongoing condition from 2020, I think there are high chances, and most of the anesthesia faculty and teachers are saying the same thing. So what I have gathered from around, I'm just letting you all guys know. So without wasting any time, do trust me that I won't ask you to go and study all of the anesthesia in last 16-17 days before your exam. Obviously that's not a good choice to make. That's not a wise or smart choice to make, and what I'm here for is to help you. So what I'm gonna be asking you is to um, focus on the important things, which I'll be giving it now, and we'll keep it as short as possible. Trust me guys, I'm going to keep it as short as possible. I'm going to speak really fast so this video covers up a lot of things in a very less of time. I know how much pressure you guys must be in. I've been through the same, so not going to waste any of your time. You can do these things in one day time, and you can revise in half a day more. Like, you can give it up according to your need. One last thing, that I have been making a lot of high yield topic list, or some of them I have already uploaded, like biochemistry, surgery, how to finish surgery in 3 days, and medicine in shortest time. I have uploaded these videos. There are some more. If you are still in need at the last moment that what topics you should revise in the end and go, so please go check them out and mark those topics in your notebook and revise them again and again before you go for your final exam. So let's go. Must do topics in anesthesia. I'm going to keep it very crisp and clear and very short and sweet. Malignant hyperthermia is very important. They tend to ask one question at least in many exams, and malignant hyperthermia is a must know. If it comes and you don't if you haven't read it, then you won't be able to mark it as well, because it's not something you read in other subjects there. So I would suggest you read it. It's not a heavy subject, it's a small one. Airway management, predictors of specifically predictors of difficult intubation is important. Airway equipment devices, please look for the equipment devices, MPG grading. These things are these equipments have gained a lot of importance because they have a lot of practical use nowadays in emergency rooms and COVID wards and everything. Airway management of COVID patient, very important. Pre-operative evaluation have always been important, is important, and will always be important. Don't miss it. Local anesthetics and inhalational anesthesia. Skip the older drugs. You don't need to read the older drugs. Just do the newer drugs like halothane, isoflurane, desflurane. If you have been following any app or any sort of coaching, then they always give you a table chart kind of thing. So there is like 4 columns, and then you can differentiate these 4 drugs. So that is a better way of learning. In one page you'll be done with it. Next is max, second effect, second gas effect, and diffusion hypoxia. These terms are most important. They often tend to confuse you among these. Please do look at them once. Then next is epidural. From spinal anesthesia, if you can't read anything else, please do read epidural one, because it's it gains more of an importance and it's more asked. That's how I can say it. Next is upper limb brachial plexus block. In the topic of peripheral nerve blocks, if anything has a chance of getting asked, it's upper limb brachial plexus block. So just give it a read. Then daycare anesthesia is important. It's a small topic. Just flip through it once so you know what it is. And propofol, go read propofol. Short note. Then oxygen gas cylinder, other cylinder, color coding, these all this practical stuff, whenever you will be watching a COVID integrated video, or in medicine or in any other subject, when they especially when they focus on the anesthesia part of it, those things are all important. So yes, that is all I want you to study in one day. Don't give it more than a day or a day and a half for anesthesia. Revise other things, revise other important. This is my Instagram handle, Shinya19. You can text me, or you can find important stuff here as well. I frequently upload things which I think of are important. And in the end, I just want to say that don't let these 18 days go by without a fight. If you still think that you are way behind in your preparation, don't lose hope. Don't give up now. This is not the time. Give it your all, and it will reward you. Trust me. You don't know how much 18 days can change your life. You would know that once you are done with your exams, and we will talk about that later. So thank you so much. Please stay tuned. Subscribe if you want to. Comment if you have any queries or any suggestions. Thank you so much. All the best.